Welcome back to part 2 of your ALH 3 lecture, chapter 14, eye and ear medication. This slide was cut off on the part 1, so I'm just going to start over here at the inner ear. So the inner ear consists of fluid-filled tubes containing the actual hearing cells of the body. It also contains the semicircular cells and the vestibule that help maintain balance. Thus, hearing and equilibrium are closely intertwined. That brings us to comprehension check number 4. The part of the ear that divides the outer ear from the middle ear is the... That is correct. If you selected B, it is the tympanic membrane that serves to divide the outer ear from the middle ear, protecting the inner ear from infection and trauma. Now let's look at medications for the ear. So medications are deposited into the outer ear and flow toward the eardrum. If the eardrum is ruptured, medications should be used under strict medical supervision. So otic medications can treat inflammation, wax buildup, motion sickness, or infections. If the eardrum is not intact, like we said, medications should be given under strict medical supervision only. Types of infection include otitis externa, swimmer's ear, otitis media, which is a middle ear infection. In swimmer's ear, antibiotic drops may be combined with the glucocorticoid to reduce associated inflammation, and systemic antibiotics are usually required for otitis media. Pain medication may also be prescribed for ear trauma or ear infection that can help with the pain or help to numb the pain a little bit for the patient. And then let's move on to the antibiotics that we talked about with the glucocorticoid combination drugs. These are used for swimmer's ear to reduce inflammation. Ciprodex would be an example of this. Also, we talked about systemic antibiotics. So we take an oral antibiotic and it helps systemically to work on the infection, and they are required for inner or middle ear infections. Amoxicillin would be an example of this type of systemic antibiotic. Pain medications, so again, we use those for infection or trauma to help the patient be more comfortable. Benzocaine is one of those medications that you might see used. And for impaction of cerumen, it's important to know that it can cause decreased hearing and pain. So sometimes we'll see a patient come in and truly all it is that they need an ear irrigation in order to get that impaction of cerumen to loosen up and come out of the ear. And then they can hear so much better and the pain goes away. So sometimes that happens. But with the cerumen can also trap bacteria and then cause the infection to form. So medications to soften cerumen are used when earwax buildup causes a decrease in hearing and causing pain and trapping bacteria, which again leads to the ear infection. Balance disorders that we can see through the ear or being caused by the ear or motion sickness, and this is the ear's inability to determine body's position relative to its motion. This is typically treated with tablets or transdermal patches. Dramamine would be an example of this, and medication should be taken 20 to 60 minutes prior to travel. Another balance disorder is vertigo, which causes dizziness, and this is treated with an anticholinergic drug, and Antivent would be an example of this. Many drugs are ototoxic, and this is most commonly seen with certain antibiotics. Tinnitus, which is ringing in the ears, hearing loss, and severe headache, and balance disturbances are symptoms of ear damage caused by medications. And so it's important to look for those when we are treating a patient with the medications for ear disorders. I hope you found this very helpful. Have a wonderful day, and I will see you in class. Bye-bye.